Dear viewers, welcome you all to our show, Orthopedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. Dear viewers, today our topic is open hand fracture, magically managed by Ilizarov. And the speaker is Professor Natalia Shikaleva, the head of hand plastic and reconstruction from Kurgan, Russia, as well as Professor Novikov sir from Kurgan, Russia. I would like to request Professor Novikov sir and Dr. Natalia Shikaleva sir to join with us.
Good afternoon, dear colleagues.
Good afternoon,
We
sir.
wait Dr. Shikhaleva a few minutes, she will come.
Okay, sir. Thank you very much, sir, for joining with us. Dear viewers, we have two learned academic experts with us. One of them is the Professor Mofakarul Barisar, the legendary Elizarov surgeon, the one and only from Bangladesh. I would like to request Professor Mofakarul Barisar to join with us.
Thank you, Tanveer, for introducing me.
Welcome, sir. And the another one is very enthusiastic from Patna, India, the Joint Secretary of Assam, India, Dr. Shamsul Huda, sir. I would like to request Dr. Shamsul Huda, sir, to join with us.
Thank you, Dr. Tanveer, and good afternoon to all.
Thank you very much. Dear viewers, we all know that the open hand fracture is a very challenging thing, and we can make an extraordinary effect by using Elizarov in case of open hand fracture. But how? And that will be discussed today. Now, I would like to request Professor Novikov sir to start the presentation of open hand fracture magically managed by Elizarov. Professor Novikov sir, would you please share your screen with us?
Dear colleagues, open fracture, this is very difficult area for treatment anywhere. For example, in Russia, we have only, this is real, only few doctors who can good help for patient with this is a problem. In our center, we have a special department where doctor can touch, operate, and support with mini Ilizarov. Before osteosynthesis of Ilizarov, our support was not so effective. And just now, we have excellent possibilities for support this is patients. All of this material from my colleagues, Dr. Natalia Shikhaleva, she will follow me after a few minutes because today in the Russia is Friday and very big meeting of doctor. Just now we have a difficult situation with COVID-19 and so many departments are closed. And just now with the epidemiologist, we decide what we will do in the next week, how we will operate, but this is our life. And epidemiology. At present, hand injuries occupy more than 30% till 18.5 among the total number of injuries. Open hand trauma is especially interesting. Its rate varies from 16 to 75%. Apart from extensive defects of cover tissues, from 55 to 85% of hand trauma cases are accompanied by crush injury of soft tissue, damage of vessels, nerves, tendons, bones, and more than 18% of infections. Material of our study over the past 10 years, the Ilizarov Center treated 145 patients at the age from 10 months to 84 years with open hand fracture. 92% of injuries occurred in male patients. Damage by woodworking and metalworking machines is the most common case of hand injuries. Totally 123 cases. And Ilizarov changed all of lives of orthopedics. And mini Ilizarov, just now, this is more than interesting and effective area of our osteosynthesis. This is absolutely another planet because everything from external fixator, technique for pass wire, and principle for fixation and destruction little bit different than when we talk about his father, a normal Ilizarov apparatus. Patients with open hand fracture groups was totally 145, and with open injuries of the hand was 93 patients and 144 patients. This is patients with open multiple injuries of hand, two hand and more fractures.
No, I am in another program. I cannot now. I am in another program. Okay.
An average one injured hand was more than 2.75 bones fractures. Isolated fractures bone on the hand and multiple fracture you can see on the graphic on these slides. Here we can show simple fracture, comminuted fracture, multi-planet fractures, bone fragments, and more was simple fracture community. Damaged diaphysis was so many patients, more than 100, and damaged epiphysis spent on metaphysis and diaphysis number was 135. The distribution of fracture in character displacement. This is big number, 237. This is more than, and fracture without displacement, only 18, small amount. Displacement and in wind was 31 patients. Displacement angle was more than 70 patients. In multiplanar displacements, 121 patients. And now you can see usually was severe fracture. Light, we haven't this situation. Very severe, near 50 patients, and medium only 23 patients. The general principles of medical care for these patients. Operations is to be performed urgently. The wires are not to be drive in the bone fragments taken in the account the directions of a wound. Level and type of fracture, displacement of bone fragments and locations of the nerves, vascular bundles. In the case of instantifications wounds, it is obligatory to reduce the fragments ideally during operation. In the other case, it is possible to leave or create the required displacement using temporary change of the shape, light, and position of the segment in order to create favorable conditions for restorations of blood circulations and wound healing. In multiple fracture, it is possible to fix the bone fragments by fixing wires without avoiding additional injury of the bone and soft tissue in the damaged area. It is obligatory to perform early functional rehabilitation, including electrical stimulations during post-op period, and external fixator allows us to do so without stability disorder of the broken bones. To apply hyperbaric oxygenation and therapy in addition to rational antibiotic therapy, extensive vascular and disaggregation therapy, and medications, injection stimulating reparating process. It is obligatory to refrain from smoking, drinking strong coffee or tea. And let me show some clinical example. This is a man, 43 years old, extensive neglected lacerations and conditions of the right hand with displacement, second metacarpal base fracture, comminuted fracture of proximal phalanx shaft of the second digit with displacement, ultra-articular small fragments, fractures. During surgery, during treatment, and functional result. Diagnosis: shotgun extensive wound of the left hand with a destruction and separation, third ray left hand at the base of the metacarpal bones, open comminuted fracture of the proximal phalanx of first finger with a full displacement, ultra-articular fracture of the head, second metacarpal bone with displacement. Foreign bodies, left hand, metal fragments, you can see. And usually our doctor has enough experience with plastic technique, open the wound, and same team, same doctor can put, this is magic, funny, but very effective external fixator, mini Ilizarov magic frame. In operations, the primary surgical treatment of wounds, the formation of a stump third ray osteosynthesis, first, second, and fourth ray of the left hand Ilizarov apparatus in the form of fixation options. Microsurgery and transosseous osteosynthesis. And in the Russia, we have icon of the three hand. And just now you can see one left and two right hands. We continued with clinical example. This is a patient with incomplete amputation of the third and fifth finger, blocked of the right hand, and operation primary surgical treatment of the wound, revascularization of third and fourth fingers, fifth finger, sorry, block, future of the common finger nerves to the second to fifth finger, primary future of the flexion and extensor tendon, osteosynthesis by mini Ilizarov fixator. And you can just now, this is patient back to the normal life, and he continued his job. In other patients, double amputation of second finger, incomplete DF, and complete and the level of the shaft. Complete amputation third finger, open comminuted fracture of the base, middle phalanx of the finger of fifth defect and of the distal phalanx. In a matter of surgical operation is performed primary debridement of the left hand finger replantation in position. And just now I'm more than happy because Dr. Shikheleva will continue all of this material, all of these patients from her magic hand, and just now she will finish our presentation. I will introduce her. Please remember,
I'm sorry.
this surgeon.
I'm sorry. I'm very
Busy.
Very busy.
She is
I'm
very
sorry.
busy.
Thank you. Welcome, ma'am. Welcome to our show, Orthopedic Solution Academy. We're eagerly waiting for you, and it will be a great day for us as because of Professor Natalia ma'am is with us now. And I would like to request Professor Natalia ma'am to continue the rest of the presentation. Ma'am, please.
And next, this picture slide with patients with amputation, multi-amputation of finger of left hand, and we made a replantation and osteosynthesis of upper Ilizarov frame, and we получили we have a good functional and aesthetic result. Clinical case, patients with trauma, ring trauma, amputation for finger, and we made ревизия раны, and we sewed nerve, sewed plastic artery and osteosynthesis Ilizarov frame, and for finger is живой leaf, and no necrosis, big necrosis of fourth finger. Next, trauma, wood деревообрабатывающий wood frame and wood machine, and we patient had amputation block finger fourth block finger of fifth fingers amputation, and not revascularization this finger opened fracture metacarpal bone and proximal phalanx of this patient. And next slide, microsurgery technique, suture nerve, suture vessels, artery, and plastic skin, and osteosynthesis Ilizarov frame. Next, this slide shows the patients with the deep wound in the wrist, in the and allow the third of the forearm. Woman, and next man patient. Trauma by glass, by sharp object, industrial injuries, and we treatment these patients and are combined and medial and ulnar nerve injuries in 97%, artery 28% of the case, and multiple 98% of all cases. Classification of carpal injuries, spaghetti types in this slide, grade 1, 4, 3, and we use this classification. And after this distribution of patients by severity of trauma, 3 degrees trauma, 28 patients, 74%. And in these patients, we use the stage of operative intervention, primary surgical treatment, identification of the end of damaged tendons and non-vascular bundles and their suture, close transosseous osteosynthesis of the forearm and hand using Ilizarov fixator, suture of the tendons and muscles of flexor of finger and hand, microsurgery stage, restoration of nerve vascular bundles, and suture of the wound. For example, patients with big wound in the lower third of the left forearm with injury of wall finger flexors, tendons, and all tendons of the hand flexors, ulnar and radial nerve vascular bundles, and medial nerve. Very hard trauma. Suture tendons and osteosynthesis of frame, Ilizarov frame, and hand in position flexor in wrist for удобный как? For comfortable suture of medial nerve and of medial nerve, and after position in flexor, we use a suture and ends of medial nerve. Post-operative care, regular dressing, therapy, medication therapy, гипербарическая
Hyperbaric oxygen therapy.
да, extensive therapy, massage, and electrostimulation. 3 or 4 weeks after gradual extension in radio-ulnar articulation starts, and after we use all полное разгибание, full extension in the wrist, Ilizarov frame remove. Result. The results evaluated by severe scale, motor restoration, sensor 1, and conclusion. The application of the external fixator allows to settle down on the problem of management of the patients with extensive wound in the 4-5 areas of the hand and the forearm or in complex, creating optimal conditions for tissue regeneration. Optimal conditions for regeneration and functional restoration are provided by acute restoration of the tendons, blood supply, and innervation of a segment in relatable of the hand in required position when it's possible to control gradual process of limb joint extension and obligatory all functional weight bearing. Thank you very much. Problems of close covalent tissue defect hand. Distribution of plastic operation on the skin in our patients you use in the slide, and for example, patients defect of skin in the forefinger and defect tendons. We use first tendons plastic with silicone implant and osteosynthesis apparatus Ilizarov frame, and the flap on artery, finger artery. Next, extensive traumatic degloving of skin, right hand from wrist to finger, and the open fracture, proximal phalanx 4 and 4 and third fingers. Photo our patients after operation, Ilizarov frame, big Ilizarov mini fixator, combining these frames, and plastic skin. During fixator with the apparatus with frame and result, good functional and aesthetic result. Patients with deep soft tissue defect of palmar surface of the first finger, big wound and very deep, and open fracture proximal phalanx. We made arthrodesis, interphalanx joint of first finger, and 2 flaps on third and fourth finger. Result. Little trauma by big problem. In this case, use flap, Moberg flap, and closed wood, and osteosynthesis Ilizarov frame. Next, gloving trauma 2. Patients with large degloving the covered tissue hand combine the fracture proximal phalanx first, second and third finger. In apparat, in hand in frame, Ilizarov frame, and the mini fixator. Combines 2 frames. Functional and aesthetic result. Post-operative management, antibiotic, vascular therapy, physiotherapy, vitamins, regular dressing, physiotherapy, and distribution methods of osteosynthesis hands bones. You see in the slide. Additional reconstructive phase was necessary in 21 patients. We made plastic flexor, tendons, tenolis, eliminate of wound scars, replacement of primary bone defects, and the prosthesis of joint brush, Latin stump phalanx, refixation in the absence of the consolidation of the hand bones. Character and number of complications of the post-operative period. Inflammation of the soft tissue, only 6 cases. Necrosis of tissue, dermatitis, redisplacement, contracture of hand joint, in non-union consolidation. Complex conclusion you read in the frame or in the slide, and maybe finish in my slide. Thank you very much.
Thank you, ma'am. Thank you for your excellent presentation. And now I'd like to request Professor Mofakrul Barisar to say something, as we know that Professor Mofakrul Barisar has to join another program that is in Tajikistan. So I'd like to request Professor Mafakrul Bari sir to say something. Sir, you have to unmute yourself, sir. We cannot hear you. You have to unmute yourself.
Question? No?
Сейчас он прокомментирует.
Sir, we can't hear you, sir.
Please unmute.
Он задает вопрос к нему. Давай мы пока отключим.
Now
Okay,
you can.
yes,
Okay.
sir. Yes, sir.
Thank you very much. It's a very fantastic topic. Both of the great surgeon, Natalia Shikhileva and Novikov Konstantin, they spoke very well and showed the very difficult cases. At the same time with the plastic surgery and mini Ilizarov. Thank you very much. And next time we will also enjoy your lecture. Thank you very much again. Because I am joining 2 lectures in Kazakhstan just now. Thank you. Okay.
Thank you. Thank you very much, sir. Now, I want to ask Dr. Shamsul Huda, sir, to ask any questions. Do you have any questions regarding the presentation to Professor Natalia, ma'am? Dr. Shamsul Huda, sir, please.
Thanks, Natalia, for a very wonderful and fantastic lecture. We have been doing Ilizarov and other parts like forearm and here, but I've seen a very, very wonderful and extensive work of combined plastic surgery and Ilizarov in hand. I just saw one point in your therapy. You said that it is a Hirudu therapy. What is that, ma'am? It was mentioned in one part. You use for healing the hyperbaric and Hirudu therapy also. What is Hirudu therapy?
Giberberitis क्या थेरेपी है? Giberberitis क्या थेरेपी है? Okay?
Sir, we can't hear you, sir. Navikov sir, we can't hear you, sir. You have to unmute yourself first.
Sorry. A few years ago, when our general director was Professor Shevtsov, we have a special department, hyperbaric oxygen therapy. And patient with severe crush fracture, we can send and support after surgery. Just now, we little bit sad because we haven't this department. Our new administration closed this department, but we have enough experience with excellent result.
Hyperbaric therapy. Okay.
Yeah, hyperbaric.
That's great. That's good. Thank you, sir. Do you have any more questions, Dr. Shamsul Huda, sir?
No, thank you. Thanks a lot. It was real good learning.
Yeah. Thank you. That was an excellent presentation. Because of the time constraint, I would like to thank all of our participants, all of our academic experts and speakers. And I think I will come in the next Friday with one more excellent topic with Professor Natalia, ma'am. And till then, I would like to say bye-bye to all of you. Before that, I would like to thank rajtv and Renata Pharmaceuticals Limited for helping us to arrange this type of program. Today, I would like to say bye-bye to everybody and hope we'll join in the next Friday with another magnificent topic regarding Ilizarov. Till then, bye-bye.
Thank you. Bye-bye.
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 You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.